what is your view on the idea of a lockdown, and how does one pull oneself out of a lockdown? Because it is, what I'm realizing now and what a lot of people are saying is, it is a psychological change. When you classify the disease and then you say we're going to have a lockdown, you change the psychology of the people, the psychology of the population, who now suddenly are convinced that this is a very dangerous thing, which it might be. But you then have to wean them off that idea, and you have to do it carefully. You can't just blow open the doors. So how does one navigate this complicated space?
I always ask about the lockdown is, what are you using that time to do? How do you prepare for releasing the lockdown, right? Because lockdown buys you time, but lockdown is not the goal unto itself. So you want to use that time to prepare a really fabulous testing, tracing, isolation infrastructure. You want to use that time to communicate to people, and now we're going to get into the psychological issues, that life will be very different when lockdown ends, that this is not about going back to what life was like last May or June, that the life over the next 6, 12, 18 months is going to look very different. And it's really about planning all of that out. So it's not just communication, but really thinking through, what will public transportation look like? Who will go back to work? What will schools do? There's a lot of work that you want to be doing during the lockdown. And the last point I'll make on this is around the psychological issues. There is a very clear signal you send to people when you lock down. You know, we have had lots of disease outbreaks in India and elsewhere. We've never had to do a national lockdown. Yeah. So you're saying to people, this is different. This is much more serious and is potentially much more devastating if we don't do this. And so now you have, when you open up the economy, you have to create a certain level of confidence, because the economy resides on confidence. And if people are scared, they will not engage in economic activity. So you have to create some amount of confidence back. It's a complicated thing. I haven't seen any country in the world do it brilliantly, but everybody is kind of making their way through these things.
The real impact and the balance here is one between economic damage and the healthcare damage. So yes. How do you think about those two aspects of this?
I think the way we have done it in Sweden is what we said. The main thing is to protect the old and the frail. They should be protected from the disease. Everything else comes second. So what we have done, we haven't completely shut down the country. Many workplaces are still open. Many people are working from home if they can. We don't have restrictions. You can go outside and meet other people outside better than in your home. Well, that's part of the answer anyway. But at some point, and I think for India, I don't know India. I've been in Delhi once at your communicable disease center in Delhi, but it's many years ago. I think you will soon create more harm than good with a severe lockdown. That's my guess.
And that's from an economic perspective.
Economic and humanitarian, yes.
What about the strategy of testing? I mean, yes, you have to test quite a lot.
Yeah.
But is there a particular method to testing? Are there certain areas that we test? How do we think about testing as a strategy?
Yeah. So people, by the way, there's nobody, I would say, well, actually, I shouldn't say nobody. South Korea, Taiwan, Hong Kong, the East Asian countries have actually done a very, very good job of this. But certainly in Western Europe, United States, people are still trying to come up with what is the right testing strategy. My general approach on this has been, you have to have, so let's kind of talk in generic terms and then maybe customize it a little bit for India. So in generic terms, you should be testing anybody with any kind of symptoms. You won't pick up everyone because there are a lot of people without symptoms. We think, probably 20% of people have no symptoms throughout their entire disease. And another 20-25% of people spread the virus before they develop symptoms, but they will eventually develop symptoms. So you should be testing everybody with symptoms. And then you should have a strategy for surveillance of high-risk areas. And so you have to sort of think about what are high-risk areas. And that's where you really have to customize it to individual things. So, we talk at least here a lot about homes for elderly people or hospitals. My feeling is anybody who gets admitted to a hospital for almost any reason in an area with any kind of an outbreak should be getting tested. Mostly because if you miss an asymptomatic person, let's say who comes in with a heart attack, or let's say comes in with a broken leg, but they're asymptomatic and spreading, they could spread it to 30 healthcare workers and 70 patients, and that would be a disaster, right? So you need a very aggressive testing strategy in high-risk areas like hospitals, like homes for elderly people, et cetera. And then, if you can, you want to be doing more community-level surveillance just to make sure that you're not missing undetected disease. So it's really a combination of all of that, and it depends on how much testing capacity you have.
I was speaking to some migrant laborers who were making this journey home, and I've spoken to quite a few of them, and a lot of them say that the really frightening thing for them is the uncertainty. That they don't know. They live on minimum wage, they live on a daily wage, and they say, look, we don't know what is going to happen tomorrow. And, that's the real problem for us. So how does one think about opening this lockdown in a way, medically, so that you minimize this type of uncertainty so you don't have an accident with a second lockdown? What are the type of things medically you need to think about?
So first thing, I think it's really important, and I've been saying this here, and I think it's really important for everybody to communicate, is that this is a 12 to 18 month problem. We are, no matter what we do, we're not going to be out of the woods. We're not going to be through this problem by July or by November. This is going to be with us till 2021. And if everything goes very, very well and we have a vaccine and it's widely available, then sometime in 2021, life can begin to go back to normal. The reason it's important to communicate that is people need to understand the time frame and need to understand that lives are going to change over that time. Obviously, for people who are very poor, who are hourly wage workers, daily wage workers, the uncertainty is very, very costly. And so this is why it's extremely important to have a strategy. So as you open up, you can create confidence in people that you're not going to have a massive outbreak. And there's a set of policies you can take to reduce that. Now, to be perfectly honest, no one can guarantee that we will not have major outbreaks. Another lockdown won't be, but you can minimize that risk. And that is the key thing that I've been encouraging political leaders, policymakers around the world to do, is implement all of those things so you minimize the chances as you come out of lockdown.
We've got a large young population that is diabetic, that has heart disease, that has hypertension. Then we have a lot of poor people who work in polluted areas, they have lung disease. So we have this cohort of people, young people, who are also very vulnerable.
We know that the biggest risk factor for having a bad outcome, from getting very sick or dying, is age. And that is one advantage that India has, that it is certainly compared to Western Europe, to America, to many other places, or even East Asia. India is a younger population, so that's good. One is we are finding more and more that even healthy young people, some percent of them end up getting very sick from this disease. And so we should not be too cavalier, even for otherwise what looks like healthy young people. Then if you get into your issue of people who have lung disease, who have heart disease, who have diabetes, high blood pressure, those people are really at increased risk. Maybe not quite as much as a 75-year-old or 80-year-old, but definitely at much higher risk. And a lot of those people end up getting very sick and dying. So we really have to, in my mind, try to protect all of those individuals, which of course ends up being quite a lot of people. And so this is why there's some people who say, well, maybe in places like India, we just let herd immunity happen and let hundreds of millions of people get infected. I think that's a terrible idea. And the reason it's a terrible idea is it will lead to millions and millions of people dying, and including a lot of young people with these conditions. So we have to take a strategy that tries to protect everybody, but particularly older people and younger people with chronic disease.
लेटेस्ट बातम्यांचे अपडेटकरिता सबस्क्राईब करा पोलीस डायरी न्यूजला आणि बेल आयकॉनला दाबायला विसरू नका. बघत राहा पोलीस डायरी न्यूज. धन्यवाद.